Welcome to AxGen Sports. My name is Stuart Kim.
This video is about a genetic test that can inform you if you're at risk for stress fractures so that you can prevent them while you train. Imagine you're training for an event like a marathon or to compete during the season or the postseason. It's key to be healthy not only for the competition, but also to not lose training time due to a stress fracture. Stress fractures are common and can take weeks or months to recover. They're caused by repetitive activity and overuse. Each workout can result in microscopic damage to your bone. If you don't allow enough time to recover between workouts, microfractures accumulate over time until they become a stress fracture, which means you'll need to shut down to recover. Genetic testing at AxGen can show if you have risk for stress fractures. Not everyone is the same. You can use genetic testing to tailor your individual training regimen according to individual risks. Here, David Roche is training for a 100-mile ultramarathon race. To perform well, David needs to train exceptionally hard. He needs to push his body right up to the breaking point while avoiding injuries that will set him back. Because a stress fracture is a repetitive use injury, a clear strategy is to reduce microfractures from daily workouts. You can talk to your coach or athletic trainer about different ways to reduce microfractures. For instance, one way is to include exercises that involve high impact load. These will improve your bone mineral density and decrease microfractures. Here, Chris demonstrates a box jump to increase bone mineral density. Let's talk about the science underlying the genetic test for stress fractures. First, all of the tests at AxGen are transparent, meaning that all of the facts and data are provided to validate the claims for yourself. You can go to www.axgen.us to learn more, or you can go to the peer-reviewed publication list here to look at the data. The results of the paper have been validated twice, which improves believability. The genetic test is based on differences between people, termed single nucleotide polymorphisms. There are two alleles at each polymorphism, one from your mom and one from your dad. A polygenic risk score looks at many polymorphisms all at once, adds them up, and then spits out the final overall score. As an aside, PRSs are really new and exciting. They were developed in the last 10 years or so and have completely changed our understanding of human genetics. Now it's possible to predict hundreds of complex traits, such as height, type 2 diabetes, heart disease, kidney disease, etc. Now for bone mineral density, the PRS uses over 22,000 DNA polymorphisms. Each polymorphism has a small effect, but the cumulative effect from all of them is large. People in the left bin have a 1.8-fold increased risk for stress fractures. The PRS explains about 25% of the variance in bone mineral density. 100% would mean that the PRS could predict bone mineral density exactly, and 0% would mean that it had no information whatsoever. For comparison, 25% variance explained is about the same as explaining risk for heart disease from high blood pressure and high cholesterol. The area under the curve is 0.79, which means that 79% of people could be correctly classified as either having a stress fracture or not due to the PRS score alone. This is about the same as being able to predict lung cancer based on who smokes or not. Is this genetic test a big deal? Maybe yes. The 1-point-fold increased risk shown in the figure may be an underestimate. It is based on data from 300,000 civilians that participated in genetic research in the UK. These civilians were generally older, 50 to 70 years old, and may not have been active in sports at all. The athletes shown in this clip are all athletes, similar in age and body type, and are pushing their bodies to the limit with regards how much they can run before getting injured. So the effect of the stress fracture test may be much stronger for active athletes such as these than it is for civilians. Because it's a repetitive use injury, stress fractures can be greatly reduced with appropriate training modifications from your coach or trainer. But remember that the test only indicates risk, not whether or not you will be injured. For instance, a stress fracture test is much more important for long-distance runners, basketball players, and soccer athletes than it is for swimmers.